Well, it appears oral cancer is on the rise, and ABC News 4 expert Dr. Nicole Dahlkemper is here from Waters Edge Dentistry. She's got some important information that all of us need to hear. Dr. D, how are you?
Good. How are you doing, Laura?
I'm doing well. So oral cancer is not really something that we hear a lot about, but plenty of people suffering from it.
Yeah, every year 40,000 Americans are diagnosed with oral cancer, and one shocking fact is that the incidence oral cancer is 3 times more common than cervical cancer.
My goodness. Well, let's just say here locally, how is South Carolina, the low country, doing?
Well, South Carolina actually is the second highest in the entire nation for deaths. And also, let me think, Charleston, Georgetown, and Richland have like the highest, let me think, higher than the state average in oral cancer, which it hits close to home.
So right here in the low country. Okay, so what are maybe some causes of oral cancer? And a lot of us, when you use dip, those tobaccos, things like that, guys or women who do, we've heard that those might be causes, but is that the only cause, or?
Well, you're at a higher risk if, you use tobacco, drink alcohol, and in the past people thought it was, just patients in 40 years old or higher, but actually 25% of all patients diagnosed have no risk factors. And HPV, which we hear a lot about, that causes cervical cancer, it actually is attributed to oral cancer as well. So there's a higher incidence now of younger people getting it.
So as a dentist, how would you diagnose someone that might have oral cancer, or I guess what is a screening process?
Well, every time a patient comes in for a cleaning, we always do a visual oral cancer screen. Like, we'll check the neck, we'll look in the mouth, look at the tongue, we'll do that. But we also have an adjunct called Visalite, and it's actually a rinse that you rinse your mouth with, and we go in your mouth and we look with a light. And what that does is we can actually look deeper into the cells in the mouth, and we can diagnose earlier. And that's the biggest problem. A lot of people are dying from oral cancer because it's diagnosed too late.
Right, and that's with a lot of cancers. People say the earlier you catch it, the better off you are.
Yeah, early detection is key. And I mean, even though we do the oral cancer screen all the time, this extra screen that we do with light, I mean, we can just diagnose it a lot earlier.
Dr. Dahlkemper, I think that we've got some pictures here, some before and after pictures that we kind of want to show people. This is a before picture of Roger Ebert before. And then here's the after.
And he was diagnosed with oral cancer very, very late. He had to have like a jaw resection, and I mean, it was very extensive. Some of his tongue removed, and he's like a perfect example. Before and after is just drastic. Yeah,
that's for sure. So when you go in and you find out, I mean, God forbid you do have oral cancer, then what happens after that? Are you able to treat that, or do we then have to go to an oncologist, or what's the next step?
If there's, sometimes if something looks suspicious and it looks precancerous, sometimes I'll stain it and take a picture, and then I'll contact an oral surgeon and they'll do a biopsy.
Okay.
And then at that point we can tell if it's precancerous, cancerous, and know what the next treatment is.
Okay, I got it. So we can get all of this done though over in your office, at least the first screenings, and it's important to go to your dentist, what would you say, every 6 months?
It's important to go every 6 months for your cleanings, but I mean, it's very important to get an oral cancer screening at least once a year, and I recommend with the Visalite once a year as well.
Right.
And then at least this month we're doing half off. Like 50% off oral cancer screens. We usually do it in April and then June, just to get a higher, higher patient.
Yeah, well, fantastic. Acceptance. Well, where are you located, Dr. D, so that we can find you?
We're located in Mount Pleasant, right across from the DMV off Isle of Palm Connector.
All right, so you need to make sure that you go see Dr. D. Anybody in your family, because like you said, age is really not. It used to be that you thought it was older people, but I guess age is not really a factor anymore. It could be anyone.
Yeah, and especially when you think it's 3 times more common than cervical cancer. I mean, us as women, we go to the doctor every year and get tested. So, I mean, people just kind of forget about oral cancer and how common it is.
All right. Well, thank you so very much for being with us. She's Dr. Dahlkemper, and she's actually one of our ABC News 4 experts. You can get all the information about her at abcnews4.com. Thank you so much for being here.
Thanks, Laura.
All right, now on over to John.
It's no surprise vacation